Good afternoon. The greatest challenge facing this generation of Americans is not going to be bridging economic inequality. It's not going to be finding renewable sources of energy. It's not going to be confronting terrorism or a rising superpower of the East. The greatest challenge for this generation of Americans will be dealing with healthcare and education here in the U.S. This generation needs to accept the following challenge. How can we get much more and spend much less? Healthcare and education are only large parts of the U.S. economy. 15% of Americans work in either education or healthcare. These are jobs that are spread all over the United States at all income levels. Don't just think about doctors and teachers. Think about home health aides, nurses, tutors, administrators. These are jobs that are hard to outsource. So if you go to small towns like Ohio, you'll find that when every other industry is left, you still need schools and hospitals, ed, and meds. And we end up spending a lot of money on education and healthcare because they're such important parts of the economy. We spend about 25% of our income on education or healthcare. The healthcare story is well known. If you compare the United States to any other country, we spend much more per person on healthcare. We've heard a lot about that system over the last 40 years. In education, we also spend a lot of money. We spend more or at least as much as most other nations per student when it comes to education, kindergarten to 12th grade. So what do we get for these great sums of money? As most of you know, we don't always get great results. So if you look at our numbers, we're 25th in the world when it comes to graduation rates. 25% of our students don't graduate from high school. We used to lead the world in college completion, and now we're middle of the pack. When you think about math and science, the foundations of the global economy, our students are just average on their national examination. When you look at healthcare, we're not first in the world in life expectancy, we're 51st. We have fewer doctors per person, higher rates of obesity, and less people with medical insurance as a percentage of our population than most of our peer countries. In fact, some estimates are that medical errors are the third leading cause of death in the United States. And the puzzle gets even more vexing when you think about who pays for our healthcare and education system. The government, federal and state, are stretched like never before. Take our home state of North Carolina. 77% of the budget in North Carolina is devoted to education and health. So when you hear politicians talking about cutting spending or tightening our belts, it's going to be very hard to do that without coming from that large piece of the pie. At the federal level, the situation is very similar. 40% or so of our spending at the federal level is on Medicare, Medicaid, the Children's Health Insurance Program, or related programs like Social Security for the elderly. Don't let any politician tell you they can balance the budget by cutting foreign aid or food stamps or veteran affairs. If we're not going to raise taxes, we must deal with this part of the pie if we're going to balance our budget. So in a nutshell, in the future, we're not going to be able to spend more on health and education. We might actually have to spend less. And that's the challenge. Everyone knows healthcare and education are essential to having a healthy and prosperous society. No one's satisfied with our current results. We'll never be able to spend more, and the question is, how do we get the results that we want out of these two systems? But for many people, the answer is disruptive innovation, technology. These kinds of trends have gone through several industries and changed the way we do business. Here's one example, the automotive industry. At the beginning of the automotive industry, companies like Ford were pioneering the assembly line to produce more cars per worker. At its peak, the General Motors company employed 600,000 Americans and made about 5 million cars a year. After successive waves of automation, the General Motors company employs far fewer people today, around 200,000, but they produce far more cars, 9 million last year. So if you look at so many industries, technology has substituted for labor and led to increased productivity. Many people are trying to apply that model of education in healthcare. That's what I'm going to talk about today. You know, it's not just manufacturing. Think about computing power. One of the greatest technological achievements of the 20th century was putting a man on the moon. In 1969, those astronauts were guided by computers back at NASA. Computing power actually wasn't that great. In fact, the computers NASA used to put a man on the moon had less computing power than the cell phone in your pocket right now. That's how fast computing power has changed. It's changed the way we work, the way we live, and the way we play. So many innovators and entrepreneurs are looking at education and looking at healthcare and trying to understand, can we disrupt these sectors the way we disrupted manufacturing, retail, entertainment, and almost everything else in the U.S. economy. So what will the future of ed and meds look like if we apply technology in this way? We think that we need to disrupt to create new opportunities. It may be a student in front of a computer without much guidance, without a teacher, going on a personalized learning path in a virtual school. It could be a patient taking their blood pressure in front of a monitor, entering the data and tracking it themselves. When you think about hardware applications like Fitbit or the upcoming iWatch, or if you think about software and other platforms like massive open online courses and Khan Academy, many people are trying to find disruptive innovations to change the way we deliver education and healthcare. But in changing the equation, I think they're missing the point. I don't think that education and healthcare will look anything like this. I think that people are probably going to matter more than ever before. Because in these industries, it's much different than manufacturing. It's much different than buying an airline ticket online rather than going through a travel agent. It's not like when you bypass the bank teller to go to the ATM. In education and healthcare, people are going to continue to matter, and maybe even more when we give them the right tools. Let me show you what I mean. So think about what made machines and computers so effective in other industries. Machines can do work that many humans can't do, and they can also do it with increased reliability and accuracy. In terms of computing, machines can take large amounts of data and they can form decisions in milliseconds, where they have data sets that explode your brain and mind. But technology alone is not going to bend the cost curve in education and healthcare in the same way. It's because people are the ones who deliver healthcare and education by and large, and people are who want to deliver healthcare and education by and large. You can never replace the inspiration of a teacher or the bedside manner of the doctor with technology, much less an app or whatever it was. We have to stop thinking about replacing teachers with tablets and doctors with wearable technologies and sensors. Instead, we need a new equation for education and healthcare. So the new equation is going to look something like this. Bringing people together, good hands, with smart technology. The doctor with the iPad is going to make a more informed decision for their patient because they have access to real-time data. The teacher or parent or student who can build a customized learning plan but then guide the student through it. We can't be thinking about substituting people for technology when it comes to education and healthcare. We need to think about complementing people and good technology. It's a completely different way about thinking of the technological revolution in these two spaces. I think that's the education and the equation of it. So, if you think about schools, you think about hospitals, there are great teachers and some great doctors out there. Some of them aren't great doctors because they play them on TV. But the great teachers out there are ones like on the left. Mr. William Taylor, who's a 5th grade teacher in Washington, D.C., in the southeast part of the city. He was recently profiled in Atlantic magazine. He's a great teacher by any measure. Evaluations, peer reviews, student evaluations, test scores. Instead of trying so hard to disrupt his classroom, instead of trying to put technology between Mr. Taylor and students, we need to figure out a way for Mr. Taylor to actually spend more time with the students. We need to find a way for Mr. Taylor to actually reach more students. And we need to find a way to figure out what makes him great and help other teachers get to the same level. Because there's a lot of variation in teaching and in medicine. We have some great teachers and great doctors, and then those who are not as great. But the issue is, instead of trying to disrupt classrooms, we actually can find a way to create a tile that lifts all those. That's what we should focus on with our technology. Take medicine. There are doctors all around the country who perform high-quality care at low cost. And unlike house, they have great bedside manner. We need to find a way not to replace the doctor with an app, or not to have patients direct their own health care, but to actually find a way for patients and doctors to interact more often with more frequency with more data to actually move the needle of technology and innovation. For many innovators and entrepreneurs, our incentive is always, and our instinct is always to try to disrupt the status quo, to try to upend industries that we see as inefficient or global. I'm trying to tell you that in education and healthcare, the triple factor can never be disrupted. You can never replace people with machines to get the results you want. And if we try to, we're going to end up with worse results than we have now. So the puzzle for all of us is finding the right technology. How do we do that in these areas? So I'm going to tell you about one project that I've been looking at. Educational apps. Since the App Store was founded in 2007, there's been about 100,000 educational apps created. I should actually say there's 100,000 apps that support the educational. And me, like 25% of other parents, is downloading an app for my child, hoping that they can learn how to add fractions with different denominators, or count to 100 without playing. Now, she's not 2 years old yet, so she might not learn that stuff right. So whether the apps work or not, whether the apps actually do what they say they are, whether the apps actually work by person, work by time, and work by child's time, is never evaluated. We have marketing hype, we have PR buzz, we have user reviews, we have no way of evaluating apps. So if you want to teach your child a new skill, you're going to throw the kitchen sink at the problem. I propose a new way. So with a colleague at Northwestern University named Ben Jones, I proposed a platform called EduStar. EduStar is a consumer course for educational technology. So teachers like another can figure out what works and what doesn't work. Here's what we do. We partner with schools to be test beds for new technologies. Not just new technologies from big companies that you've heard of that make all the textbooks, but small companies that you haven't heard of that make great products. They test them in head-to-head clinical trials the same way you test a drug in every place. The difference is we do it much more fast and much more cheap. And when we get the results, we align them with the common core standards, which have been accepted by over 40 states. That way we know what the apps are actually aligned with things that actually matter on the assessment students are facing. And then we publish the results on a website for students, for teachers, and parents. EduStar, and what ideas like it, on how about disruptive education? That wasn't our intent. We actually want to shape the education system to work better, to put good tools in the hands of teachers. That's the technology revolution we need. Now, EduStar isn't just an academic idea anymore. An organization called CFY in New York City has decided to pioneer EduStar and make it a reality. They've raised $7 million to date to make the EduStar platform come to life. And it's ideas like this that I think we need in technology and education. There's a similar one I'm working on recently, and one that I haven't cracked, but it has a lot to do with the same technology applications. There's a revolving door in many parts of our hospital system. 1 out of every 5 patients under Medicare who's in the hospital will be discharged and come back to the hospital within 30 days. Think about that. 20% will come back within 30 days. And who pays for those costly readmissions? You do. I do, through our tax dollars. And we can use technology, software and hardware to try to reduce readmissions, to get more compliance and medications, to increase communication between doctors and patients. One of the apps that I found that works really well for this is not an app I'm affiliated with, but it's one that works. It's called WellDoc's BlueStar. This is people with diabetes. So here's what it is. BlueStar provides education, nutrition information, and motivation, the best practices that we know how diabetes patients manage their care, and applies all in the app. What's best is the app allows doctors and patients to communicate in real time and sends blood glucose readings from the patient directly to the doctor. Think about this now. If the doctor knows what the daily or weekly or monthly readings are, that's one thing. But what about in a minute? When you use an app like this, you can actually keep in touch with real-time with your physician. And that's what makes this app special. Now, what's even more amazing is it actually got approval by the FDA. The app was found in a clinical trial to reduce blood sugar levels of patients with type 2 diabetes. Think about that for a second. Not a pill, an app. Okay? This is the future where we're deploying the mobile technologies. Again, evidence created and a difference made with a well-balanced BlueStar. In the end, I think we need to move towards putting the right technology in good hands. What do we mean by the right technology? We need evidence. We can't be afraid to generate evidence that says that our favorite apps or favorite hardware don't work. There's a smartboard in almost every classroom that I look at right now. And there's very little evaluation of whether smartboards actually make a difference. We need to put smartboards and other software and hardware devices through tests to see if they actually enhance student learning. If they do, we should put more in it, and if they don't, we should put something else in it, or maybe try something different than that. It's the same thing with mobile apps for healthcare. All the things you can use to track your own health. If they're not approved by the FDA, there's not some evidence for it, it's very difficult to know whether they're actually going to work. And in the world of 100,000 or 200,000 or million patients and students deserve to know. That's being the right technology. And the last part is about good hands. I think for entrepreneurs and innovators, we can't escape the fact that there's a messy personal side to healthcare and education. Don't use that as an excuse to go innovate in some other far-off place, concierge medicine or virtual schools. Use it as an invitation to come and actually understand what makes great teachers great, what makes great doctors great. If we understand that, we'll do 2 things. We can build smart technologies that actually build a big piece of care and a piece of education. And we find a lot less resistance from the experts in the field who actually know what they're doing. If your app is actually valuable to help them do their job, you just want to use it. Instead of trying to disrupt the system, you need to try and shape it to build a new equation. So, bending the cost curve, healthcare, and education isn't the traditional formula curve. It's not technology minus people equals cost efficiency. It's not substitution. I want you to reimagine a new equation. The new equation is smart technology, evidence-based, interacting with skilled people that drives increased value. Where's that value going to come from? It's going to come from lower costs by reducing hospital readmissions. It's going to come from saving time for teachers so they do less paperwork and spend more time with students. And it's going to come with training and productive workforce that can make a difference. Changing the equation between ed and med in healthcare and education, that's the challenge this generation must accept